my talk is suture patch. And actually, Paul introduced a little bit, but I show more detail. Oh. Yeah, so always I say the graft for SCR must be thick and stiff, but it's not easy to make a thick and stiff graft in all patients because sometimes the fascia lata very thin, even in the metastatic very thin. In that case, it's hard to make a thick and stiff graft. So to make this thick and strong graft consistently, we developed a suture patch with access company. We sandwich the suture patch between the layer to layer of fascia lata. Then we can make a very strong and stiff and thick graft. So I want to show more detail. And this is a kind of a thin fascia lata. We cover the suture patch like this. Then we did a show. Then here is a big guy, the Mark Harrison is a big guy in our sales company. He tried to push the human head to the acromion, but no contact. It means that the tension effect, not space effect. After a show, using the suture patch with thin fascia lata. It's 10 years ago in Singapore access lab. Yeah, actually, I'm very young. It's like 10 years ago. Yeah. Then, yeah, we take out this graph to check the stiff shoulder or not. If the specimen is very stiff, of course, no contact. But after take out the suture patch and the fascia lata, it's hit very easily, so no stiff shoulder. And also we did a biochemical study, the tensor testing of suture patch augmentation by comparing thin fascia lata with suture patch and thick fascia lata. So thin fascia lata only 435 Newton, but thin fascia lata with suture patch almost triple, and almost same as thick fascia lata graft. And this is the stiffness. The thin fascia lata 51 and thin fascia lata is suture patch is 1.6 times and much higher than thick fascia lata graft. And also we did biomass testing using the shoulder custom testing system in Tyrese Raw. We compared the intact and tendon tear model and SCR using thin fascia lata and SCR using thin fascia lata and suture patch. And here's the result of super translation. Of course, after the custom model created, significantly increased the translation, and same as the previous study, thin fascia lata SCR decreased the translation, but still higher than intact. But suture patch with the thin fascia lata SCR, it's almost same as intact. And also we check the range of motion to see the stiff shoulder or not after surgery because suture patch very stiff material. So this is the result. Even SCO using thin fascia lata or suture patch augmentation, actually no change in the range of motion. It means the suture patch does not cause stiff shoulder after surgery. Again, we sandwich the suture patch between layer to layer. Then already we have done the 92 cases because in Japan we could use that the suture patch 2 years ago. So already 2 years passed. Then graft tear rate only 2%, very high healing rate. So yeah, I really recommend this the suture patch to if you want to if you do the SCR with fascia lata or other graft, I think. And then I want to show this picture. It's a very interesting picture. I used the suture patch for the total shoulder, made the total shoulder, and actually we covered the subscapularis to augment subscapularis when I finished when I did the total shoulder. Then 6 months later, some pain in the patient, so we converted the reverse. At that time, we checked the suture patch. Then this is the photo at the time, 6 months after surgery. Then we cannot see the suture patch anymore because the new tissue covers entirely suture patch. Actually, suture patch just attached on top of the subcapillary. So just after surgery, we can see the suture patch in this view, but now we cannot see because maybe the scar tissue, but the very many new tissue cover the suture patch. So it means if you use the suture patch on top of the tendon, maybe the augmentation, some supraspinous tendon repair, maybe you don't worry about any abrasion or maybe the subsequent impingement because the new tissue covered completely, maybe like a scaffold. So anyway, the suture patch consistently produces a thick and stiff and strong fascia lata graft. Thank you very much.
Thank you, Teru.